Yes. Okay. As Catherine explained, the population with hearing loss consists of several subgroups with distinctly different cultural and communication characteristics. For example, regarding the degree of hearing loss, the age of onset, and the preferred language of communication. In my presentation, I will be focusing on people with acquired hearing loss. I'm Dr. Dalia Tsimpida, and I'm passionate about research that transforms the lives of people with hearing difficulties. I'm a chartered psychologist with a background in health psychology, health policy, and health services research, and doctoral studies in audiology here at the University of Manchester. I'm going to talk to you about an important part of our lives. I'm going to talk to you about hearing. And hearing is important because hearing connects us. We humans are made for relationship, and hearing, for those not natively deaf and fluent in sign language, is central to the sharing of emotions and ideas and happenings. Hearing loss may affect the mental well-being, the interpersonal relationships, and the participation of the individuals in society. When somebody loses their hearing, not only the ear function itself is affected, but also related activities, for example, understanding speech during communication, the participation of the individuals in society. For example, people with hearing difficulties have limited employment opportunities, and there are many barriers in education, in attending social events, or receiving health services. This perspective will inform my presentation in our event today, which has the title Hearing Health Stories, Manchester Health and History. I'm going to cover two topics. Why do socioeconomic and lifestyle factors matter, and the importance of hearing loss prevention while we are young, and why that is important. Hearing loss is a major public health issue, estimated to affect over 11 million people across the UK, which translates to 1 in 6 people. By 2035, it is estimated that there will be more than 15 million people with hearing loss in the UK. This is 1/5 of the population. Hearing loss is far beyond a sensory impairment because it has many physical, social, cognitive, economic, and emotional consequences and affects the quality of life. To date, acquired hearing loss has been labeled as something which is more likely to affect the elderly. However, our research in the Institute for Health Policy and Organization at the University of Manchester shows that our focus should not simply be on the age of older adults, but on factors which impact on people earlier in life, which, if modified, could reduce hearing loss in older age. Hearing deterioration is a lifelong process and not an inevitable result of aging. Understanding this process is an essential step in addressing the global burden of hearing loss. I have recently proposed a novel model that shows how we can prevent hearing loss in older people by addressing socioeconomic inequalities encountered while we are young. First, I will explain why socioeconomic position and lifestyle matter. The unequal distribution of power, money, and resources in society leads to social inequalities. As a result, some groups of people are more privileged than others, which creates injustice and disadvantage that influences life experiences and health outcomes. Hearing health inequalities is an emerging research area, and I and my colleagues recently proposed a definition saying that hearing health inequalities are the avoidable differences in people's hearing health across different social or population groups. The mechanisms by which these inequalities are generated remained unclear so far. So during my doctoral studies, I developed the first theoretical framework which adopts a life course epidemiological approach in understanding the modifiable lifestyle risk factors for hearing loss. Let's now look at this novel model that depicts the modifiable determinants of hearing loss in several stages across the life course. Children born to parents from a lower socioeconomic background tend to experience more illness and injuries, and the antibiotic drugs may affect hearing health, especially in sick babies with a genetic predisposition. In turn, consequences of hearing loss in children can include impairment in language skills and lower educational achievement compared to children with normal hearing. The lower educational status is also related to the lower health literacy, which is a common issue among people of a lower socioeconomic position. That can explain why individuals of a lower socioeconomic position adopt an unhealthy lifestyle with higher levels of smoking and alcohol consumption, higher body mass index, and lower levels of physical activity, which are all risk factors for hearing loss. The lower educational level is a predictor of social inequality in later life as it limits employment opportunities, relegating people to more poorly paid jobs. Furthermore, low-level manual jobs are those with a higher level of occupational noise, which is a high risk factor for hearing loss. Occupation and income, then, may affect access to hearing health services and hearing aid use due to the financial barriers that affect the help-seeking behavior for hearing loss. These hearing health inequalities can affect the retirement status and income of older adults as they affect their ability to continue working or to advance occupationally. Also, hearing loss affects communication in healthcare settings and so affects the quality of care and management of other health conditions that are commonly comorbid with hearing loss. As hearing loss deteriorates, this lowers socioeconomic status further and results in a worsening cumulative hearing health over the life course. Tackling socioeconomic inequalities in hearing health during the life course could significantly improve the hearing health of populations. The model of hearing health inequalities aspires to be used as a novel tool for the prevention, identification, and management of hearing health inequalities and for policy formulation aimed at hearing loss risk reduction. So we can see that several preventable factors are involved to a large extent in the pathways of the association between socioeconomic position and acquired hearing loss. These findings are supportive of a new conceptualization of hearing loss, which argues that hearing loss is not necessarily an inevitable consequence of aging, but a potential preventable lifestyle disease as linked to environment and lifestyle. The term age-related hearing loss is not an inclusive term to express the many hearing problems without a specific etiology in older age. So we propose to the scientific community a new term, lifestyle-related hearing loss, where lifestyle refers to social practices and ways that people live that reflects personal, group, and socioeconomic identities. Of course, the lifestyle choices are influenced by the social, economic, and environmental conditions where you live. However, more than 15% of hearing loss cases are preventable, and people can play their part in making decisions in everyday life concerning hearing loss prevention that will help them to maintain or improve their quality of life during the life course. For example, according to data from the World Health Organization, today over 1 billion people are at risk for hearing loss due to unsafe personal use of portable music devices. The risk of permanent hearing loss arises from repeated, regular, daily exposures to high sound levels. Therefore, noise-induced hearing damage can be prevented to a large extent by reducing exposure time and levels. Short-term exposure to loud noise can also cause a temporary change in hearing or a ringing in your ears, which is called tinnitus. However, exposure to high levels of noise can cause permanent hearing loss, and neither surgery nor a hearing aid can help correct this type of hearing loss. So you can see that hearing loss is an important public health issue. And let's now see why you really need to protect your hearing while you are young. Hearing loss affects the whole quality of healthcare and patient safety. People with hearing loss often find it really difficult to communicate with health providers, and very often they are left unclear about their condition and medical instructions after an appointment. This is what deaf or hard of hearing people feel when the hearing people speak to them. It is hard work. It is a really hard work, and this is crucial not only for the patient but also for the healthcare professional, so as to be able to communicate with the patient with a hearing loss about symptoms of a health condition and to do an accurate diagnosis. It is not surprising that in another recent study I found that almost all deaf and hard of hearing people were dissatisfied with the way health providers communicate with them and did not have trust or confidence in the health professionals. Hearing may also be a driver of other health problems, for example, depression. In a recent study, I found that those with hearing loss had 40 to 58% higher risk of having depression. In addition, hearing loss is linked not only with depression, but may also be a signal of cardiovascular disease, Alzheimer's and dementia, diabetes, chronic kidney disease, is tied to threefold risk of falling, 32% increased hospitalization, and greater risk of mortality. The WHO World Report of Hearing emphasizes that the functional ability of people is not maximized unless individuals have good hearing. I will show you a video now about the gallery we presented earlier this year on World Hearing Day. In our research in the Institute for Health Policy in the organization, we highlighted that the focus regarding acquired hearing loss should not simply be on the age of older adults, but on factors which impact on people earlier in life, which, if modified, could reduce hearing loss in older age. This approach in hearing health can lead to the development of appropriate interventions and public health strategies that can have significant health policy and practice implications. To promote this novel approach, I organized the Hearing Care for All virtual gallery project. This project was organized on World Hearing Day on behalf of the Institute for Health Policy and Organization with the generous support of the World Health Organization, the World Hearing Forum, and the Coalition for Global Hearing Health. Aim was to engage local and global communities and policymakers and promote hearing health during the life course. The activities for World Hearing Day included a photography competition, to promote hearing health. The online exhibition that you are looking in the video at the moment, which included visual art and poems relevant to the WHO messages for the day: hearing care for all, screen, rehabilitate, communicate. And also, I presented an online special topic lecture, including a live Q&A chat. The public engagement activities reached a global audience, and the gallery featured 45 entries from 15 countries: United Kingdom, Greece, Italy, Spain, Belgium, Poland, South Africa, Kenya, Namibia, India, Rwanda, Uganda, Philippines, Australia, and Mexico. And nearly 3,000 people visited the Hearing Care for All virtual gallery.